All right. Good afternoon, everyone, and welcome to Culinary Medicine free webinar. So this afternoon, we will be talking about gallstone disease and dietary interventions. I'd like to greet our attendees from Luzon, Visayas, Mindanao. We have attendees from Pakistan, attendees from Malaysia, Singapore. We also have attendees from India. Okay, so thank you for joining us this afternoon. So if you miss some of the webinars we had in the past, you can go back to our website and check on them. So there are recorded webinars there that's ready for your consumption. So for this afternoon, this will be a short discussion about gallstone disease and dietary interventions. So in culinary medicine, we really believe that we can help a lot of people with gallstone disease. So we wanted to focus not only on helping patients with gallstone already, we also want to focus on helping patients avoid gallstone disease. Now, we know there are risk factors, and we know that there are medical treatments, and most of the patients diagnosed with gallstone disease are advised for surgical intervention. So what can we do in culinary medicine, and what can we do in terms of lifestyle intervention so we can help patients with gallbladder stones? So for this afternoon, we'll be dealing primarily on dietary interventions, but we'll also discuss about lifestyle, other risk factors as well. So before we go ahead, I'd like to shout out, if you're here, we just had our culinary medicine in-person workshop this afternoon. So we had two batches. So we have the morning batch and then the afternoon batch. So we discuss about nutrition prescription for children and adolescents, and we also dealt with chronic conditions that's usually seen among children and adolescents. So these are our afternoon batch. They're still downstairs enjoying the food they prepared. So for today, we actually cooked high fiber lasagna. So the lasagna we prepared is actually made of the pasta that we use is actually infused with whole grains, and then we use the cheese that we use for like the ricotta. The white cheese. The ricotta that we used here is made of nuts, and we made sure it's packed with fiber. And of course, the meat that we used here are coming from from meat substitutes. And then we also made mushroom fritters, and then we made high fiber chia parfait. So we mix fruits, and fiber. So we usually give this for negative calorie preloading. So that's what we give children, especially or adolescents whom we wanted to decrease their calorie intake, because we do not want to restrict our children from eating. We don't want to reduce the amount of food they eat. So we just tweak with the calories of the foods they usually eat. That's what we can do. Remember, kids are very sensitive. They usually associate food and flavors to memories, experiences. So we make sure that they have good experience when they enjoy plant-based food. All right, so going back to our topic this afternoon, we will be talking about gallbladder disease. So to some of you who are not familiar where the gallbladder is, so you can find that at the upper right quadrant of your abdomen. So for those doctors who are here, you're all familiar about this. For primary care physicians, we usually handle patients with gallstone disease, and it's becoming so common nowadays. So usually, the gallbladder will just give you symptom when there's blockage right there at the ducts. But for as long as they are just here, sometimes there's only 1, 2, or 3 stones. About 80%, of gallstones are actually incidental findings, right? So when you say incidental findings, they are silent gallstones. So 80% of the time. So patients may have ultrasound results. Usually they would be requested for an ultrasound for other reasons. And then incidental finding would be gallbladder stone. So again, the gallbladder is found at the upper right quadrant of the abdomen. And so why the gallbladder gives you pain, that could be because of the obstruction that's caused by the stone up there. It could also give you pain when it's residing on the neck. So it really depends on the size of the gallstone, right? So, and then we know that there are three types of stones. Basically, we have the cholesterol stone. Cholesterol stone, the texture of that is like egg yolk, right? So, and then this is the easiest stone to manage because they're not thick, and then they're not hard, and they easily disintegrate. But we also have pigment stones. Pigment stones are really hard. They're like rocks. You know? And then we also have mixed stones. So some stones are made of pigment stone in the middle, and then they're coated with cholesterol stone. Now, how do we know? So we get ultrasound, the request for ultrasound, but to really know whether this is cholesterol stone or pigment stone, then that would be harder unless you have your ERCP. And so there's a camera that can view all your gallbladder, and somehow you will see the stones right there. So commonly, when patients would come for consult, a gallstone pain would usually bring you to the emergency room. But again, 80% of the time, gallbladder disease is silent, right? So gallstone disease is usually silent. So we also wanted you to know where do you find where is the pain usually starts. So for gallstone disease, usually after eating a fatty meal, you usually feel pain. It's vague pain, it's dull pain, somehow in the upper right quadrant of your abdomen. And then oftentimes it radiates at the back. So you will feel pain at the scapula, right? In your wing bone, and then it radiates even to your arm. So usually they increases in intensity over time, and we usually note this after eating a fatty meal. So the character of the pain, it's slow and steady. It's dull, but it's also severe. And the pain can bring you to the emergency room. Okay? So usually the trigger for this is any fatty meal. So since we say any fatty meal, remember we've always discussed that your body will always understand the nutrient language, right? Nutrient language, not necessarily the food language. For example, you took your fat coming from avocado or coming from olive oil. Let's say you ate plant-based meal. So it's a pasta, and then it's cooked with a lot, let's say, it's cooked with a lot of oil, right? And then the cheese used there is also made of cashew, and then you took a lot of nuts, right? So remember, they're also packed with fats. This may be good fats because they are plant-based, but again, your body will understand that as fat. Versus you eating a full plate of steak, so it has the fat right there, it has the saturated fat. Of course, you have your protein there, you have other ingredients there. Your body will understand the nutrient language. So your body will interpret that all together as fat, whether it came from plant-based fat or it came from animal fat. So since fat will trigger the pain in your gallbladder, so what we want and what we always advise patients with gallstone disease is to decrease intake of their fats, and we want them to increase intake of their fiber. So again, either a plant-based meal full of fat or an animal-based meal full of fat, with this both will actually trigger gallstone disease. But it really depends on the intensity may be different. There are articles saying that the pain may be different or the trigger might be lesser for plant-based food because it will take you more amount of plant-based food to have that huge amount of fats compared to just a single serving of animal-based food. You can easily get the right amount of fat to trigger the pain for your gallbladder stone. So let's say, for example, if that steak is cooked over butter, and then added with cream, etc., etc. Okay, so what are the symptoms when there is a blockage of gallstone? So these are the things we wanted to take note. There's always pain. The pain is constant. They're not going away. Even if you take pain relievers, you still feel the dull pain. So that means the intensity of the pain may somehow go down because of the pain reliever, but then the pain is still there. And then patient may develop fever and chills already because of the infection. There's already inflammation. And then there's associated nausea and then vomiting, and there's heart rate acceleration because of the infection. Now, if there's blockage going on, so that means the gallstone have blocked the ducts, so you may develop jaundice, right? Why jaundice? Because your biles cannot come out. It can't get out of your gut. So that means it's reabsorbed towards your blood, and so you become what? Yellowish. So you turn jaundice. So there's yellowish discoloration of the skin and also in your eyes. And there's also signs of sunken eyes and then dark colored urine. So when you see this happening, and sometimes your stool also can turn white. So that means there could be some stone blocking the ducts. Now, what are the risk factors for gallstone disease? I think this is really important for us to remember, and because this is where we can intervene, right? So first, family history. Can we do something about it? I don't think so. If you're born to a family who are stone formers, that means your dad, either your mom or your uncle, your auntie, or members of your family may have gallstone disease. That means you may have a risk factor to develop gallstone disease as well. You might be stone former as well. Being a woman is already a risk factor. If you're age over 40, that's an additional risk factor. If you are obese, that's another risk factor. And if you have a diet usually high in cholesterol and low in fiber, then that will add to the risk of developing gallstone. So again, where do we intervene? So we cannot change your gender. We cannot modify your age. We can modify your weight, and we can modify the dietary intake that you have, which is actually the trigger of developing gallbladder stone, right? Another risk factor is lack of physical activity, being sedentary, taking of birth control pills, pregnancy, and patients with diabetes and patients with Crohn's disease, hemolytic anemia, and of course, cirrhosis of the liver. Now, let's go and talk about the modifiable risk factors. Number one, let me go back to that slide, is your weight. Number two is intake of high cholesterol diet and a lower intake of dietary fiber. And then the third is sedentary lifestyle, meaning you lack exercise, and of course, diabetes. These are modifiable risk factors. How about birth control pills? Given the chance, if you have other way of family planning, then that could be considered. But if this is the only way you can do it, then we cannot change this risk factor here. So let's go back to obesity. I'm not sure if you're able to attend some of the webinars we had about obesity or weight reduction. You may check our website if the recorded webinar is there. The number one modifiable risk factor that we manage among patients with chronic gallstone disease is weight. So we want them to reduce weight, but please take note that sudden weight reduction may also trigger gallstone formation. So that's why when we actually manage patients, when we enroll patients for weight loss program, our goal is for them to somehow achieve a weight reduction of about 1 to 2 pounds per month to avoid formation of gallstone. Okay, so it's one of the risk factor, but we do not want drastic weight loss because we do not want to develop gallstone disease. And then next is high intake of cholesterol in the diet and low fiber. So we should know where the cholesterol are coming from. Now, in the previous webinars we had, we already discussed where we get cholesterol. So you find this in animal-based product. Cholesterol is not supplied by plant-based products. We hope I'm clear here. So even with tropical oils, we get saturated fat from tropical oils. We get other fats from tropical oils, but we do not get cholesterol from plant-based products, even if they are oil. But again, remember, if you take a lot of saturated fats, let's say you take saturated fats from palm oil, you take saturated fats from sunflower oil, or many different kinds of oil. So they will also trigger your liver to produce more cholesterol than it's normally producing. All right, so that's what you will see in the labels when you buy oils. It says there zero cholesterol. You see there vegetable oil, zero cholesterol, right? Or palm oil, zero cholesterol. That's true, right? But then if you look at the profile of these oils, the one that has the highest saturated fat content is actually palm oil. So we know that the higher the saturated fat, the higher the tendency or the higher the risk of developing more cholesterol because it will trigger your liver to produce more cholesterol than it is normally producing. So remember, your body needs cholesterol. So that's why our own tissues, they produce the cholesterol that we need. That's needed by our hormones, right? So why do we have a lot of problem with increased cholesterol in the blood? Because of the external sources. So it's the exogenous sources of cholesterol. That's the problem. So remember, so it's the endogenous production of your cholesterol and then the exogenous source of cholesterol. That's the total cholesterol that you have in the blood. All right. So what we also wanted to emphasize here is the intake of fiber. So this is where we needed fiber load. Among patients with gallstone disease, we wanted to increase their fiber intake as much as we can. Now, in my practice, I would usually prescribe supplemental fiber for patients with gallstone disease, for patients with high cholesterol, high blood cholesterol, uh, especially among patients who cannot really, who cannot actually sustain a high fiber diet. You know what I mean? They will tell you, oh, I don't think I can get rid of high fat meal yet because I'm not cooking at home. The only available breakfast is this and that. You know, I'm not the one cooking at home. I only eat whatever they prepare. So if you think they cannot promise to decrease their intake of fats from their diet or cholesterol, I think it's best for them to take more fiber. You can get it from supplemental fiber. There are milled fibers you can buy. Psyllium is one. There are other fibers available in the market that they can use, and the ideal time to take it is during mealtime. So usually I would prescribe before eating the main course. If you think this is high cholesterol, high fat meal, then you take your fiber first. Why do we want them to take their fiber first? Number one, they occupy space in the stomach. So remember, our stomach can accommodate approximately 4 cups of food per meal. So if you occupy that, 1 cup would be coming from the fiber. It could be fiber drink. It could be a soup full of fiber. It could be a bowl of fruits, for example. Then that's a negative calorie preloading already. So you loaded your stomach with fiber. Remember, fiber is carbohydrates, but they are 0 calorie, right? So when fiber is already there, and then you eat the fat, remember your fat will bind with your fiber, right? And then when you defecate, it goes with your stool as well. And then the insoluble and then the soluble fiber is also important because it also works with the metabolism of cholesterol. That's why it's also beneficial, and they actually cause decrease in your cholesterol. So they kind of opposite, right? So when you have high fiber diet, it decreases your cholesterol. When you have high cholesterol and low fiber diet, that triggers the formation of your gallstone. All right, so that one we can control. And then being sedentary is another thing. So why this is indirectly related to gallstone, which is also considered as risk factor, because we know that if you take a lot of calories and then you're sedentary, that's positive energy balance. So positive energy balance means adiposity. You form more fats, so you get bigger and bigger. So we want patients to be somehow active, move more. So if they cannot really say they can do exercise by just moving more, decreasing sedentary lifestyle. So meaning we ask them to at least stand every hour and then just move and stretch. We also have to take note on the non-exercise thermogenesis. So that means you still you still use energy, you still use your calories, even if you're not exercising for as long as you're moving. So household chores, for example. So just don't sit longer. You stand, you walk, you stretch, you do something, even wiping, even sweeping the floor, watering the plants, then cleaning windows, they would all require calories somehow. All right. And then lastly, it's diabetes. We know that diabetes is a modifiable and reversible, highly reversible chronic condition. And I believe we've talked about diabetes already. Kindly go back to the materials on our website and learn more about diabetes, because in lifestyle medicine, when we deal with patients with diabetes, we don't only talk about managing their diabetes. We also wanted them to achieve remission if it's possible. And especially if this is not overt diabetes yet, let's say this is just pre-diabetes, our goal for patients with pre-diabetes is really reversal of their diabetes. So this is where we can give dietary intervention, and this is where culinary medicine really plays a huge role. Why? Because this is where we modify dietary intake of patients. So let's say your dietitian would calculate or would make you a meal plan, then how do you translate that on your plate? Right? So for patients with diabetes, studies actually found that if you decrease the calorie from fat down to 15%, you will be able to address insulin resistance, which is the culprit of diabetes type 2. And so when we decrease the intake of fats down to 15%, we also manage gallstone disease, right? So this is hitting two birds with one stone. So among patients with diabetes, we take care of the fat. Yes, we're so concerned about the carbohydrate intake that they have, but we are more concerned of the types of carbohydrates that they are eating. So please take note, what are the components of carbohydrates? Usually we have three. We have the fiber, we have the sugar, and then we have the starch. So the general rule is we can stay steady on starch, and then we can take more of the fiber, and then take lower refined sugar, right? So every time you eat anything that's refined, if this is white bread, basically it's carbohydrate minus the fiber, right? Because the fiber was taken out. If you eat white rice, for example, so the fiber was taken out, so that what's left? It's starch and sugar. So the fiber was taken out. So what's going to happen with the calorie? Will the calorie of unpolished rice be different from the calorie from white rice? The answer could be yes, because let's say 100 grams of white rice has calorie. The calorie of that is 4 grams 4 calories per grams. And then for your unpolished rice, it's also 4 calories per grams. But remember, if this 100 grams would have 10% fibers, then you only got to multiply 90 times 4, because fiber is actually 0 calorie. So it will not give you calorie. So the higher the calorie for refined sugar as well. And of course, they have higher glycemic index, and then they have higher glycemic load. So for diabetes, we're not only concerned about the glycemic index, we're also concerned about the glycemic load. For example, your watermelon has higher glycemic index compared to other foods, but then their glycemic load is low. What I'm trying to say here is that your sugar can easily spike after eating watermelon, right? So your blood sugar can easily spike, but then they have low glycemic load, and so they can actually go down easily, quite easily. Why? Because they have low glycemic load. Compared to pastries, refined carbohydrates, you eat your cake, so it's loaded and packed with sugar, and then it also has fat and other ingredients. So it can trigger glucose spike, it will increase, but then it has huge glycemic load, and so it will plateau, depending on your activity, and so it can go down, it can go down for a period of time. So unlike Compared to the watermelon, it can easily spike your glucose, but then it usually goes down right away because of the low glycemic load. So I hope you got that. So take note both the index, glycemic index, and then the glycemic load, because we're so fixed. We're just looking at the glycemic index. So again, we manage diabetes because we wanted to decrease the risk for gallstone disease. So again, when we manage the gallstone disease in the kitchen, when you're in the kitchen already, so we focus on fat. So the guideline for patients with gallbladder disease is look at the types of fat you're eating, look at the amounts of fat you're eating. So like for example, if you just suffered from gallbladder colic, that's too painful, it's dull, it's severe pain, and that can bring you to the emergency room. You would need the help of your doctor in the emergency room, to get rid of the pain. It's too painful. So we manage gallbladder stone by looking at the fats. We decrease intake of fat. All right, so that's clear. We decrease the intake of fat, especially among patients with acute gallbladder pain. So what are the sources of fat? I've mentioned earlier, it could be plant-based sources and it can be animal-based sources. The question would be, can you eat fats again? The answer is actually yes, right? But again, some amounts of fat can really trigger gallstone disease. How do we know? And when will it trigger? We'll really never know, because it's when the stone would go up to the neck of your gallbladder. I've shown earlier the photo. When it goes up there along the neck of your gallbladder, that can cause pain already. Why would it cause pain? Because whenever we eat fat, what's going to happen with your gallbladder? It will increase peristalsis. It will move, right? Because your gallbladder needs to spit out fat so that it can pass through the duct, so that it can be delivered to your small intestine, so that you can metabolize fat. So the more fat you eat, the more the gallbladder moves. The more the gallbladder moves, the stones are moving, and then it triggers the stone to dislodge. So when they dislodge and they can block your duct, then that triggers the pain. So that's the reason why when you decrease your intake of fat, it decreases the peristaltic movement of your gallbladder. It decreases the risk for dislodging your gallbladder stone. Right? So I'm not sure if you've heard about natural way of flushing the gallbladder stones, because there are many successful stories about that, using culinary ingredients such as olive oil, such as extract of apple. The pectin in apples are really important when you want to dissolve gallbladder stone. But there are successful medical interventions for gallbladder stone. So if you think you have some symptom of gallstone disease, better consult your physician, have yourself checked. It's ultrasound that's going to say you have gallstone or not. And then you can start with medical treatment. So we have a drug that can dissolve gallstone and then take care of your dietary intake, and then try some of the interventions that can dissolve your gallstone. You needed professional help if you wanted to do this. At home, right? Because there are formulations using culinary ingredients to dissolve stone. Usually, it's a combination of dilators, it's a combination of laxative, and then a combination of fat as well, because you wanted to trigger the gallbladder to spit out the stone. But of course, that's not possible if your stones are bigger than the ducts. I hope that's clear. When you get your ultrasound, we can actually read there. We see the size of the diameter of the stone, and then we compare it to the diameter of your ducts, your bile ducts. So if the stones are small, or they could be sludge. When you say sludge, they are really like they're like coconut oil, coconut oil that you place in your fridge. So that means they're solid at room temperature. So that could be that consistency of the sludge. Then they can be easily removed. So remember, from sludge, they form stone. So when you see the sludge initially, then your goal is to remove the sludge right away. So we don't want your gallbladder to be full of stone, because basically we'll end up with surgery. So I think this is the last slide. There's what we call the gallbladder stone diet chart. So if you look at this diet chart, I got this from one of the articles, and I think it's interesting. Looking at the number of the prescription for the calories, this is about 1,800. Of course, this is not fixed because we have to see your TDEE. We calculate for your TDEE. We look at your basal metabolic rate, and then we calculate your TDEE based on your activity, right? And then we determine how much calorie you need. And from that calorie, we talk about splitting your calories. So how much of the fat you need, how much of the carbohydrate, and then how much of the protein. So in this chart, it's pretty clear here that we wanted to decrease your intake of fat. So we usually recommend calories of fat coming from plant-based sources predominantly. Well, we're not saying you cannot eat meat anymore, but it should be predominantly coming from plant-based sources. Most of your calorie will come from complex carbohydrates, and we want also the salt to be 1,000 milligrams. That's the recommendation for this article. So again, the protein is just there. You need a good amount of iron. We need a good amount of calcium, not too much calcium, right? And when you look at the time when we feed patients with gallstone disease, we want to feed them complex carbohydrates from what you can see right here. So it can come from the sources of the fiber can come from fruits. Sources of fiber can come from whole grains. It can come from whole wheat, they call these grains, or it can come from beans as well. So again, our goal for patients with gallbladder stone is to decrease their fat intake to avoid acute pain or acute colic because of gallstone, because of the dislodging gallstones. All right. So again, we focus on fat, and our goal for for patients with gallbladder disease is, for the meantime, decrease their intake of fat to decrease the trigger of gallstone pain. All right, so I think that's our last slide. I think we have a few minutes to entertain questions if you have. Okay, so let me answer this question. I have one question here. Do we have a plant-based dilator? Now, if you mean dilator of your ducts, we usually use this comes from minerals, right? Usually we use magnesium sulfate to do this. So it's a mixture of your laxative. No? So for plant-based sources, yes, there are plant-based sources, but these are herbs with very limited what they call this evidence to say that this formulation is safe. Although there are protocols already that's available, this is mostly available under complementary medicine and functional medicine. So remember, lifestyle medicine and culinary medicine is food-based perspective. But if you have an expertise, if you had training to deliver the services, or this protocol to patients, and you're trained to do that, then maybe that can help patients, right? All right. So again, this webinar is recorded, and we will be posting this on our website, so you can go back. You can go back to the material for your consumption. Okay, so thank you everyone for joining us.